Hello, my name is Scott Smith, and this video will focus on assisted outpatient treatment and the considerations necessary for courts. This training is part of the Assisted Outpatient Treatment Toolkit. For more information, please visit behaviorhealthjustice.wayne.edu/AOT. In this video, we will cover an overview of assisted outpatient treatment, the benefits of assisted outpatient treatment, eligibility for assisted outpatient treatment, the process for pursuing assisted outpatient treatment, and some final notes on assisted outpatient treatment. Assisted outpatient treatment in Michigan also is known as Kevin's Law, and it was named for Kevin Heisinger, a 24-year-old student from the University of Michigan who was killed while he was in a Kalamazoo bus station by Brian Williams, an individual living with schizophrenia back in the year 2000. Prior to killing Kevin, Williams had repeated contact with law enforcement and numerous psychiatric hospitalizations due to his non-adherence with psychiatric treatment. In response, the Michigan legislature passed assisted outpatient treatment legislation, dubbing it Kevin's Law in his honor. And the initial law went into effect in 2005. This law has been revised most recently in 2019 to bring it up with the best practices for assisted outpatient treatment. Individuals who are living with a serious mental illness are far more likely than other individuals with a mental illness to fail to seek treatment, to adhere to existing treatment. They're more likely to avoid those who point out that they're ill, and they're less likely to recognize that they have an illness at all. As a result of not treating their serious mental illness, they also experience increased rates of suicidal and self-harming behaviors, violent behaviors, homelessness and housing insecurity, high utilization of emergency rooms and inpatient psychiatric hospitalization, and they also have a lot more contact with law enforcement. There are many reasons why individuals living with a serious mental illness do not treat their illness. And assisted outpatient treatment is especially well suited to address the following: poor access to care, housing instability, co-occurring substance use disorders, paranoia related to treatment. For example, beliefs that medications are poison or that their treatment providers want to hurt them. And a condition known as anosognosia, which refers to an individual's impairment in the ability to recognize that they're even ill. When we talk about anosognosia, we're talking about a very common condition among individuals who live with a serious mental illness. Researchers have found that among individuals living with a diagnosis of schizophrenia, between 50 and 98% experience anosognosia. Among individuals living with bipolar disorder, nearly half, about 40%, experience anosognosia. Assisted outpatient treatment addresses the problem of treatment non-adherence from two directions. First, for individuals, it compels them via a court order to receive mental health treatment. And secondly, for the mental health system, it commits them to providing the treatment to the individuals on the order. The goal of assisted outpatient treatment is to reduce the negative consequences associated with untreated serious mental illness, especially suicidal behavior, homelessness, inpatient psychiatric hospitalization, high emergency room utilization, co-occurring substance use disorders, and criminal behavior. Benefits of assisted outpatient treatment. Of the states with assisted outpatient treatment laws, New York is one of the most studied. In New York, individuals who were placed on an assisted outpatient treatment order typically were diagnosed with a psychotic disorder, had an average of 3 inpatient psychiatric hospitalizations in the previous 6 months, were not adhering to their psychotropic medications, had co-occurring substance use disorders, had been arrested or incarcerated, and had experienced recent homelessness. People receiving assisted outpatient treatment in New York experienced reductions in many harmful consequences associated with serious mental illness, including a 55% reduction in suicidal behavior, a 74% reduction in homelessness, a 77% reduction in inpatient psychiatric hospitalization, and alcohol and drug use were reduced by nearly 50%. They also saw much less contact with the criminal justice system, with arrests decreasing by 83%, violent behavior by 47%, threatened violence by 43%, and property destruction by 46%. Assisted outpatient treatment has a low program cost, but results in huge savings across all systems on a county, state, and even federal level. The cost for an assisted outpatient treatment program per person in urban settings was about $5,239. Suburban environments, it was a little bit more at about $6,284 per person. When looking at the savings after implementing the assisted outpatient treatment order, on average in urban environments, there was a 47% reduction in expenditures per person, and in suburban environments, a 58% reduction in expenditures per person. There are many services available via assisted outpatient treatment, including case management, medication, and very often this occurs via long-acting injectable formularies. Laboratory tests to determine whether medications are being taken and working, outpatient therapy, day or partial day hospitalization programs, educational or vocational training, supervised living, such as in group homes, assertive community treatment and forensic assertive community treatment, substance use disorder testing and treatment, and other services at the court's discretion, services that treatment providers recommend to prevent the relapse or deterioration of the individual's health. Eligibility for assisted outpatient treatment. Assisted outpatient treatment is available to adults who do not understand that they need treatment due to impaired judgment resulting from their illness, are unlikely to voluntarily participate in or adhere to treatment necessary to keep them from harm, have a mental illness, not exclusively a substance use disorder or a neurological condition such as dementia. There are times when guardianship may be more appropriate for somebody than assisted outpatient treatment, and vice versa. Guardianship is most appropriate for individuals who are unlikely, even with treatment, to be able to make sound, independent decisions. For those who have a limited history of autonomously functioning, and for those who have medication allergies, medication contraindications, or their condition is treatment resistant. AOT, on the other hand, is more beneficial for individuals who are likely, with treatment, to be able to make sound, independent decisions, who have some history of autonomously functioning, and medications are not contraindicated for them. Process for pursuing an assisted outpatient treatment order. The process to obtain an initial order for assisted outpatient treatment is as follows. First, an adult files a petition with the probate court seeking assisted outpatient treatment only or a combined order of assisted outpatient treatment and inpatient psychiatric hospitalization. The probate court reviews the petition and schedules a hearing. The subject of the petition may be hospitalized while awaiting a hearing. The petitioned individual receives a psychiatric evaluation if necessary. Clinicians testify to the individual's condition and need for assisted outpatient treatment. These clinicians make recommendations for what the assisted outpatient treatment order should include. Finally, if the court feels there is compelling evidence, an initial assisted outpatient treatment order can be issued up to a maximum of 180 days. When a clinical evaluation is necessary, it is the responsibility of the community mental health provider of the county in which the individual resides for individuals who have Medicaid or are uninsured. For individuals who have private insurance, including Medicare, it is court arranged. Final notes. While assisted outpatient treatment can be enormously beneficial, it's important to consider the following. Assisted outpatient treatment is designed to prevent incarceration. As such, using it for inmates is to be limited to extreme situations. For instance, when there is medication noncompliance that results in an inability to attend court or be released. It's important to remember that assisted outpatient treatment is not a replacement for a forensic evaluation. And finally, it's important to remember that assisted outpatient treatment is time limited. Proper evaluation of whether guardianship is a better option should be considered first. Thank you for participating in this training. We appreciate your commitment to improving the lives of individuals with mental illness.